I think the thing I'm most excited about with our healthcare policy is how it's been developed. With the help of about 2,000 Albertans from all walks of life, all corners of the province, and they've helped to shape and guide this policy. The thing we've heard over and over again from people is they want more focus on prevention and more focus on healthy living. They're very concerned about rising childhood obesity rates, and so we would introduce a comprehensive school health program to help our kids be the healthiest they can be. And we know that if we don't get our prevention in order, we're going to have ballooning costs in the future. So they really want us to focus on preventing disease rather than just continually treating it. We also know that the early childhood years are critically important. From the time that the child is inside the mother's womb to the age of 6 is a critical time, and a lot of the disease is actually laid down in that time. So we have to invest in those early years. So prevention, you know, the saying, a stitch in time saves 9. Albertans want healthcare policy that reflects that. The next thing they want is access to quality care. We feel that every Albertan deserves a primary care relationship, whether that's with a family doctor or a nurse practitioner or some other health professional. But again, if we don't have that primary relationship, then little problems grow into big problems and they end up in the emergency wards. So we want to see a focus, a shift back towards family medicine. Our healthcare system right now is really overloaded with specialists, and we need to move back to family medicine. And this is particularly true in rural Alberta. The next thing people told us is that they want a comprehensive mental health strategy. I think we've been a little squeamish about mental health as a society. We haven't put it on par with physical health, and we really need to change that thinking. Alberta has one of the highest suicide rates, and I personally know 4 people who've died by suicide, and that is a really sad indication of how many Albertans are living in distress, and we need to start helping those people. And right now the system is a bit disjointed. There are many gaps, and we need to provide a seamless continuum of care for mental health in particular. And finally, in the area of governance, people want to see some changes there as well. We've shifted towards this centralized super board in recent years, and there are some benefits of centralization in terms of bulk buying or efficiencies with administrative processes. But what we've lost is the ability for people to make local decisions and meet local needs. And our frontline workers are getting very demoralized because any decision they want to make has to go up through 17 layers of the chain of command. So we've really stifled innovation. People have solutions, they know what their communities need, but they don't have the power to implement that. So we'd like to see a shift there and a balance. And finally, in the area of accountability, we know that people have a lot of questions about the transparency of our system. The Alberta Party, with many of the other opposition parties, have joined together and called for a public inquiry to look into the allegations of doctors feeling silenced if they can't speak out, and that is a really important step, but it's not the only step. We would also like to see stronger internal disclosure mechanisms so that frontline workers can always come forward with their ideas and have those ideas implemented. We also want to see firm and fair whistleblower protection legislation. Many jurisdictions have this already. We don't have it in Alberta, and we need it. And finally, we want to see an independent health auditor put in place, somebody who is truly arm's length, who can provide a report card to the public and to the members of legislation, letting them know how we're doing, what's going well, what needs improvement, so we can be continually improving our system. And finally, you know, with our policy, it's never done. We're always looking for new ideas, so if you have suggestions, if you want to get involved in building policy with us, you can reach out to us through our website, and we'd love to hear from you. We'll take good ideas no matter where they come from.